Now, the Israeli Prime Minister has held a rare press conference with international journalists to defend his controversial plans to seize Gaza City. Benjamin Netanyahu spoke just before his country faced heavy condemnation for its conduct in the war at an emergency meeting of the United Nations Security Council. He said taking control of Hamas' remaining strongholds was the best way to end the war and secure the release of hostages. Here's some more of what he had to say.
No nation can accept a genocidal terrorist organization, an organization committed to its annihilation, a stone's throw from its citizens. Our goal is not to occupy Gaza. Our goal is to free Gaza, free it from Hamas terrorists. The war can end tomorrow if Gaza, or rather if Hamas lays down its arms and releases all the remaining hostages.
Juliette Touma is Communications Director for UNRWA, the UN Agency for Palestinian Refugees, and she's joining us now from Amman, Jordan. Juliette, thank you so much for joining us. Can I ask you, what does the Israeli Prime Minister's plan, as we've been hearing, to once again expand military operations in the Gaza Strip, what does that mean for the people there?
Thanks for having me. Simply more and more suffering in this horror show that is absolutely endless. More displacement, more killing, more loss, more grief, and intensified cycle of endless killing and war.
Prime Minister Netanyahu has said many times that reports about a hunger crisis in Gaza are exaggerated. In his press conference just last night, he claimed there is no starvation and there's certainly no Israeli starvation policy. What is your reaction to that?
Well, data coming out from United Nations clinics sums it up. In Gaza City, where hunger is most severe, 1 in every 5 children is malnourished, something that Gaza has not had before the war started almost 2 years ago. Our staff at UNRWA and journalists, colleagues of yours, are hungry themselves. They're fainting in the middle of the road or while in the line of duty. There's not much going into Gaza. As an example, at UNRWA, the agency where I work, we have been banned from bringing in basic supplies, including food and medicine, for over 5 months now.
Netanyahu was saying that Israel is working with the US to create a surge of aid into Gaza. As you say, UNRWA has been banned. So does UNRWA it's not involved in any of these plans at all to bring aid into Gaza?
There's no need to reinvent the wheel or to be stuck in these proposals and statements that never materialize into action, which means that nothing is improving for the people of Gaza. There is a system in place that's led by the United Nations, including UNRWA. All we're saying is allow us to do our work, allow us to bring those trucks of food and medicine and hygiene supplies in, just like we were doing during the ceasefire at the beginning of the year.
So what have the consequences then been of removing UNRWA from allowing it to bring aid into Gaza?
The starvation and the hunger that is massively spreading in Gaza is only one testament to this ban that was imposed on the largest humanitarian agency. And the longer this ban continues, we will have more children dying of hunger, more children suffering. We've seen yesterday reports from Save the Children that at least 100 children have died of malnutrition. And all of this could have been prevented easily if UNRWA and other humanitarian organizations were allowed to bring in the minimum every day. And that is 500 to 600 trucks of basics, including food, but also medicine and other supplies, medical supplies for the hospitals. We're not asking for the moon here. We've been delivering this consistently every day during the ceasefire for 6 weeks. And if you recall, that's why we were able to collectively avert famine.
What would it take, in your view, to quickly scale up humanitarian assistance to meet the most urgent needs in Gaza right now?
A political will for the gates of Gaza to be open so that humanitarian assistance can flow on a regular basis, a deal for a ceasefire so people on the two sides have some respite, for the hostages to be released and be reunited with their families and loved ones, and for those who sadly were killed to be buried with dignity so that their families have closure. We gotta have this deal. The clock is ticking very, very fast, and we are inching closer to losing our collective humanity.
Juliette Touma from the UN Agency for Palestinian Refugees, UNRWA. Juliette, thank you for your time. We do appreciate it.
Okay.
Joel Onyeke is head of operations for the aid group Save the Children. I asked him how he's preparing for another Israeli expansion of military operations there.
Well, there is no preparation that can that guarantees anyone any measure of safety within Gaza right now for a population that have been, distressed by over 22 months of war, and Save the Children haven't been here long enough and watched, all the access impediments. We can tell for sure that there is no way to be any better prepared for what's coming, if anything eventually, happens with the planned full invasion of Gaza. One thing we do know for sure is children have continued to pay the price for this, unrelenting war that they, have no part in completely. And the negative impact of this can actually be seen and felt on the ground, that if it's, escalates more than it currently is, then I don't think anything will be left of Gaza.
Israel has come under increasingly severe criticism for what's being described as a hunger crisis in Gaza, a description that the Israeli Prime Minister Benjamin Netanyahu disputes. He says these descriptions are exaggerated. How does that compare with what you have seen and you and your colleagues have seen and heard on the ground?
Yeah, so the situation on the ground is one that is very catastrophic. The starvation and the hunger is real, and this, escalated over time. Over the past few months since we had the access, impediment placed on, or the embargo placed on bringing in humanitarian aid into Gaza. Between March and now, very little humanitarian aid has been allowed into Gaza. And the negative impact of this, like I rightly mentioned at the start of this interview, is the starvation that we're seeing, the high-level malnutrition. Save the Children currently runs 2 primary healthcare facilities where we run, screening and treatment of malnutrition. And we have seen the numbers of malnourished children quadruple over the last 3 months since this access impediment or embargo on, humanitarian aid coming in, started. Save the Children, out of its mother-baby area spread across the street, screens over 14,000 children every month, and 10% of those children come out malnourished. The recent Independent Space classification data that was released shows that every child in Gaza is at chronic risk of famine. Over 70,000 children under 5 and over 17,000, pregnant and breastfeeding women currently in Gaza are malnourished. And these figures are not cooked up. They are figures that are backed up by assessments and act of real fact. A visit to our PHC, you can actually see, that's our primary healthcare center. You can actually see the number of malnourished children who are coming there every day to get one support or the other.
Right. And how are your own staff eating there? Are you able to feed yourselves there?
Well, the situation is not different from being, working for an NGO and being like every other Gazan. So yes, they are feeling the same impact. The market is highly volatile. There are no items in the market. The humanitarian aid hasn't come in as it should. the number that is needed to, survive the average Palestinian is not available. I was speaking to my colleague just last week, and I asked him, just come into the office, how are you? And his response to me was, Joel, I'm not fine. My children are hungry. My wife and my mother are hungry, and there's nothing I can do about it. I cannot go to scramble for aid falling from the sky, because I'm better off alive to them than dead and leaving them to themselves in this crisis. So the reality is real, even for I and my colleagues who are working within this context. And the only way this can be better is if there is a definitive ceasefire in place and the much needed humanitarian aid is allowed into Gaza through the UN-led channels for us to evenly distribute aid to the vulnerable population in Gaza.
Thanks for talking us through that, Joel. Joel Onyeke from Save the Children in Gaza. Thank you.